So thank you everyone for joining us today. The Aurora Chamber of Commerce has been very active in communicating government updates and providing information sessions to shed light on the concerns of local businesses. We've been advocating with all levels of government on behalf of our businesses, and we have been providing training sessions on timely topics such as pivoting your business, ensuring the financial health of your business, reopening best practices, etc. We've been profiling many of our local businesses as they reopen, and we are leading the Shop Local marketing campaign as a member of the Aurora Business Continuity Task Force. The Chamber will continue to support the needs of business as we work through the various phases of reopening, and we look forward to meeting the needs of our local businesses. This panel is not meant to be an experts panel, but rather a panel where we will be sharing what individual businesses are doing to keep their employees and customers safe. From a medical perspective, some tips on returning to work safely and how to deal with medical situations that might arise will come from our nurse today, Vicky McGrath. So joining us today are Khamissa, owner of Omar's Shoes, a family-run business that's been in town for 50 years this year. Stewart McLaren, president of Almac Industrial Systems. Dr. Pahsa Nasirzadeh, Wellington Aurora Dental. And Vicky McGrath, who's a franchise partner at Nurse Next Door. I want to thank you all for taking the time to be with us today. I would like to begin the session by asking each of you to discuss your return to work plans from an employee and customer perspective that you have either already implemented or are preparing to implement when allowed to open. Then I will ask Vicky to share some of her best practices on a healthy return to work. Each panelist will have 5 to 10 minutes to describe your process so that we have time for Q&A at the end. And if you have already been open, please share some of your experiences with clients and customers during your first few days. So let's begin. Raz, would you like to tell us about your process for Omar's Shoes?
Sure. So before we opened up last Tuesday, we were looking to source a lot of the PPE product and try to get things in the store to try to get ourselves ready for when the time comes that the government said things were okay for us to open. So we took steps like finding hand sanitizer, alcohol, trying to source it from wherever we could find it, sneeze screens, and then just coming up with some procedures for our plan for when staff were going to be coming back intermittently as we started. So we were able to get a bunch of it ready when we were advised almost 2 weeks ago that you could open after the long weekend. We opened on the Tuesday. We had sneeze guards up. We basically have put a policy right in front of the store so we can let our customers know that we have taken steps that are above and beyond what the standard regulations of what the government's expected. So we have, we're not enforcing that the customer has to come in with a mask. We're saying whatever you're comfortable, the only thing is that you do have to sanitize when you come in. Our thinking is if you sanitize your hands, if there are any germs on your hands at that point, that will take those away. And then the concern was, can you touch shoes? Can you not touch shoes? So we can't stop people from touching shoes because that's how you tell what you like. That's how you can feel it. We've just asked people to, limit what they touch. But so they sanitize, they come inside. The staff will all have either a mask or a visor or both, whatever they're comfortable. They have to wear one of the two. I prefer the visor just because you can see me, you can see you can hear what I'm saying better. You can see if I'm smiling. And to me, the shield gives you a little more protection. Because in the shoe business, it's a little hard to keep 6 feet away. So there's times if we have to fit a senior, someone that's disabled, we're gonna have to get a little closer. So that shield over your face helps to protect the employee from anything that gets splashed on them. So that was kind of our thought for protecting us. The next step is we'll help the customer find a shoe. Whatever the customer tries on that doesn't take, we then quarantine the shoe or clothing that we carry, and we quarantine it for 48 to 72 hours. If we do need to pull something out of the quarantine, we have a special spray that we've been able to acquire that is 99.9% alcohol, that it sprays, that doesn't harm the color, anything in the leather or the clothing product. So if we have to pull it out sooner, we'll spray it down. And then again, we're trying to make sure that we're protecting our customers and our staff, and make sure that the customer feels comfortable that it's a good experience. As it is, we're seeing some people that are so stressed out when they're coming in the store. So we're just trying to de-stress the situation. Mm-hmm. As far as our staff are concerned, in the back rooms, we have to limit where we're going down. We have narrow hallways or aisleways for shelves, so only one person in that aisleway at a time. You'll go get your shoes. You'll help the customer as best as can be, trying to keep our distance. And then once the customer's done, we'll send them up to the front, and there's a cashier there that will look after them, look after the customer. As soon as they're done, we will clean that area, and the employee that was helping the customer with the shoes will then clean the area that they were sitting with. We have a bleach and water, 10-to-1 water to bleach that we're using to clean that area. Right after that, the employee will next go to the bathroom, wash their hands, come back and say, okay, I'm ready. So in the past, where we might have been able to help 2 to 3 to 4 customers at the same time, we're really only able to help 1 to maybe 2 customers at the same time. So how does that affect our business down the road? That time will tell. We're limiting the amount of people coming in the store. So we're trying to keep it as a comfortable environment that, again, we're not trying to scare anybody. We want to just make them feel welcome. As far as returns are concerned, returns are accepted, and we're spraying those down straight away, making sure that it's clean, and then we put it on a quarantine shelf just to be overcautious so that we can make sure that there's no issues. From what we understand, there's nothing being passed from feet, so it's basically whatever you're touching, and then you're touching your face. So that's why the staff are asked to wash their hands all the time, as often as possible. And then we have a standard, the staff will, before they come into shift, will call us if there's any issues health-wise. When they come in, there's a form that they have to fill out just to let us know if there's any issues as well. So we did actually have one employee that called and said that he had a cough. And the first thing we said is, okay, don't come in, call telehealth. He ended up going to the hospital and getting checked, and now we're waiting for results. So we're taking whatever steps we can to try to be as proactive as we can. And that's it. Lots of signs around to make people feel that, just to remind people about, what we're doing. So yeah, that's it.
That's great. Thank you, Rez. And do you have any of it posted on your website, any communication around what you're doing?
So we actually did have a suggestion come from a customer to actually put it on our website. So we're in the process of letting people know our procedures so that if they're looking at it ahead of time, they can feel comfortable we're taking those steps.
Okay, great. Thank you. All right, Stewart, I'm going to turn it over to you now, if that's all right.
Yeah, that's fine. Can you hear me all right?
I can, yeah.
We're a bit of a different situation. We're a manufacturer, so don't have a lot of people coming into our facility. And the first thing we did was we locked the doors and had a sign up. So we've been in this back to work now for since the first week of April. And those that can work from home do work from home, engineers and salespeople. But your plant and your administration staff couldn't do that, so they're at work every day. So I want to talk about a couple of things, more about how we manage our employees opposed to customers coming in and out of the office. The ones that do come to the office are truck drivers, delivery people, and they've been very good, actually. They're already trained, and they don't really want to come in. There's no documents to sign anymore. It's all electronic. Deliveries come in, and we put them on the side. And so that's basically the courier people and the steel deliveries and things like that. That's fairly easy to take care of. Separating the lunchrooms, we took all the chairs out there, staggered the shifts in lunchrooms. They're separated by 6 feet. We have 3 times a day, we have a wash down of all handles, doors, washrooms, facilities. So it's quite labor intensive. But one thing we have done that I think you may want to, if you have staff or you have employees, is to have the twice weekly meeting with them, kind of a town hall, because they're nervous and they want to hear what the company is doing for their protection and for the protection of their families. We tried to stress okay, we're at work, we're fortunate to be working, a lot of people aren't working, so, you know, we can't control you outside of work, but maintain your physical distancing when you are, and it's basically to home and back to work as much as possible. We developed 2 policy manuals. We have one that's a health and safety manual that's internal to the management of the company. And it changes, and it's actually it's pretty rigorous, but I don't know if we can enforce it. Then there's a policy manual for the employees, and I can share those with you if you want to have them. One thing you may deal with, and we've dealt with it already, or it's come up, is refusal to work for employees and how you handle that. And refusal to work is a tricky situation. We've had both cases where people said, I'm not ready to come back to work. Well, are you working and getting paid? Or are you not getting paid? We're not, you know, it's a difficult thing, and we're all under financial stress right now. We've had people that want to come back to work, and we had to tell them, you know, no, for the first stage. They didn't want to be at home anymore. They were tired of it. So that may be another issue you have to deal with. So policies around those things are pretty important, and communicating with your employees is pretty important. I think there's 3 or 4 levels of stress. There's the people that don't give a crap. They'll just do whatever they want, whenever they want. It's about 10%. There's about 40% that are optimistic and they want to go out and do things. There's another 40% that are kind of cautious, and then there's the 10% that are just scared. So, and you probably have a mix of all those in the people you meet, your customers or your employees. So, and you can't pretend to know all the answers to this, and you've got to be straightforward with your employees. And I really think the customer issue for people that have retail operations is going to be a learn as you go and manage issue. I feel kind of lucky that we're not in the retail business. I don't know how, and people that have clients they have to see, it's going to be tough for them to do that work. But if you do have some staff and you do have some written policies, and you talk to your customers or your employees and show them, here's our written policy for our company or our retail, it gives them a sense that you are active in trying to keep them safe. So if you want, I can share these things with you or send them to the chamber. Sandra, you're interested in that, but
That would be great. Thank you, Stewart. That would be nice.
that's
Yeah.
really all I have to say about it, and good luck to everybody. It's not easy.
No, thank you. And thank you for the whole communication piece, because we hear that from everyone, how important communicating with both your clients and your customers and your staff is on a regular basis. So thank you for that. I'm going to turn it over to Dr. Pahsa now.
Thank you. Thanks for having me, first of all. This is, I'm glad to be here. Especially after the news yesterday about healthcare professionals being able to go back to work, which, especially in the dental sector was, I heard it just like everybody else on the news. We haven't had any guidelines from our college yet. We have received the emergency guidelines last week, which were pretty detailed, but since yesterday, we're still working as it stands. All of the dentists in Ontario are working under emergency and essential care situation. So elective treatments are still not being done until the guidelines are out. We shut down mid-March, and we have been shut down since. There is enough emergency clinics in the area that are managing their patients. So in that regard, we've been thankful. But the preparation has been very difficult for us, obviously, because the nature of dentistry is in a way that there is no social distancing when we're working in the room, and we haven't had to deal with the type of virus or the type of communication that has been happening. We try to keep everything evidence-based, and that makes it a little bit challenging as well, because the evidence is a little bit spotty at times, and we're not sure exactly whether certain studies are done in a certain way or not. So what we've been doing so far is we're trying to go a little bit overboard in terms of ensuring that there is no communication, there is no disease transmission or pre-screening, and making sure everything is safe. So some of the things we've been doing with our staff, we've been having weekly meetings ever since mid-March. We have created a manual and sort of a return to work manual under these circumstances based on the college recommendations so far. Some of the, I mean, your appointment to the dentist is going to be a little bit different depending on each practice. Each practice is going to be different based on their space and the way they operate. But certain things are going to be very crucial for everyone. We're going to do a lot of pre-screening over the phone, a lot of video and tele communication with patients prior to having them in the office. There is going to be pre-screening questionnaires both the day before and the morning of. We're going to limit the number of patients that are going to be coming into the office at a time. And essentially our waiting room is not going to be used anymore. So we're going to, our aim is to allow enough time for appointments so that when patients get in, they check in from their car or from the plaza when they get in. We will let them know when their room is ready, and they essentially have a contactless check-in and check-out completely through the office. While they are, so this will make it very crucial for us to have all the information we need for that appointment. So a lot of times those consultations, a lot of questions back and forth, all of that is going to be done by me through a medium like Zoom or through the phone. The other thing is we're going to be limiting the number of people in the office. So, so companions, friends, spouses, parents who might have questions, all of that is going to have to be done over a medium like this. I think that's going to be very difficult to do in our office setting as it is now. Now, the actual infection control guidelines, we've done a lot of things over the last 3 weeks. We've had to do some calculations on our airflow and our HVAC systems. We have had to look into installing walls to have sealed rooms in order to not have aerosols exit the room. And there is a downtime in between patients that is required. We have purchased HEPA filters for the rooms, which is going to help with the circulation and cleansing of the air. Now, there is a wait time in between patients based on the amount of time it takes to turn over 99.9% of the air that's in each room. So on top of that, we're going to have enhanced PPEs. That's going to be the difficult part. As you know, there's a shortage of PPEs in Ontario. We're trying to get our hands on as many as N95s as we can, and gowns and all of that. We have been able to secure enough of that and get our staff fit tested for all of it. Going forward, you know, provided that the PPEs are there, I think everything is going to be going well, provided that the supply chain is there, and provided everybody's okay with moving at a slower pace. We may have to wait anywhere between 30 minutes to 2 or 3 hours, depending on the nature of the procedure from patient to patient, which obviously from a business perspective is going to have a huge effect on how we operate. Now, we don't know what the new guidelines are going to be. We're waiting for it momentarily in the next few days to come out, and we'll have an idea of what those things are going to be like. We've had a lot of, we've started communicating with our patients through through means of making videos of how an appointment is going to look like. We're going to put that on all our social media channels. They're going to be on our website. And so they know, I mean, these are the things that everybody has, including the patients and the staff, are going to have to be trained by to a certain extent. We're going to have hand sanitizers at the door when they come in. And the idea is that at that point, once they walk into the first area of the office, the clients don't touch anything in the office. We open all the doors for them. We take care of everything. All the communication is going to be through digital. I mean, we were about 90% a digital paperless practice, but now even the medical history forms and all that are going to have to be done online, and there won't be any sort of physical communication with anyone. You know, we're going to have enhanced disinfection through all the common areas. Every hour, we're going to have staff basically disinfecting every surface in the waiting room, in the back. Obviously, the operatories are always going to be disinfected just like before. And the pre-screening is going to be key. We're going to have a set of 7 questions. If anybody screens positive for any sort of risk, we're going to have to reappoint them in 2 weeks and monitor the situation. Obviously, there's going to be cases where people may be at a higher risk of potentially having the virus, and they may be in an emergency situation where they have to be seen. We have to find times and ways where there is nobody else in the office that potentially we could do an emergency procedure if need be. For the most part, about 99% of the time now, all of those procedures are being done just by medication and remotely, so there is no aerosols generated for people who are at a higher risk of having the virus. Thankfully, our staff, because of the nature of what they do, they've been well trained on infection control from the beginning. When we've been communicating with them on a once or twice a week basis over Zoom, so everybody's up on their information and what we're going to do in their training, and we're just going to, I think next week, we're going to do a couple of trainings in office to sort of go through the process and start by probably a much lower capacity, maybe 1 or 2 patients in the morning, 1 or 2 patients in the afternoon, and slowly build up the speed and figure out what we have to do and what we need to do as we go along.
Thank you. That's very, very rigorous. You can hear from the different businesses just how rigorous what everybody has to go through is through this time, and how everybody really needs to think about what they need in their business, because each business is just a little bit different from everyone else's. So I hope that these conversations help people to think about what they need to do. I'm going to turn it over to Vicky McGrath now. Vicky, I think you're unmuted. If you want to go ahead.
Thanks, Sandra. Hi, everyone. Vicky McGrath, owner of Nurse Next Door Home Care Services, serving Aurora. So we were considered an essential service, and so we've continued to care for our clients in their own home through the pandemic process. And as a result, of course, you know, we were most intimately involved with all of our clients at all time. And as a result of that, there were a number of sort of clinical interventions that were put in place for Nurse Next Door. We had a daily caregiver screener that all caregivers were required to do prior to their first visit every day, and also a client screener that the caregiver was to ask of the client upon arrival at the visit. And this was a screener, you know, comparable to the one that you would have seen in the whole pandemic process. Have you had any symptoms today? Are you feeling well? Have you had any visitors? Anyone visiting from some who has traveled in the last 14 days? The typical screener. And I shared a lot of the materials that I'm going to be speaking about with Sandra. So she's got them and is willing to share them with everyone if you're interested. And so on top of, you know, the intimate nature of the care that we provide in terms of the personal care and we had to ensure that, generally speaking, you know, we were prepared with a pandemic plan. And thankfully, we have gone through the accreditation process through Accreditation Canada and had a pandemic plan already prepared and ready to put into effect. And that really also helped us as well. So many of the franchise partners across Ontario work together on that accreditation process. And so we were all able to have a consistent rollout really for our pandemic plan, which worked out. Of course, nobody ever anticipates having to implement their pandemic plan. So it worked out really well that we were already in good place with that. So our caregivers in the home, as long as they were asymptomatic, they were able to go to work and work with our clients remotely in their own homes. And at the time that they were going to see our clients, they would only wear gloves during personal care and only wear a mask if the client had any symptoms, or if any family member of the client had any symptoms, or if the client or family member had recently returned from a hospital. So in general, the caregivers were just going into the client home just as you and I would walk around our own home. And this actually worked out really amazingly, that none of our caregivers or clients have had the virus. And that's because of having really stable clients, stable caregivers, and really understanding where our clients and caregivers are moving around. And most of our clients, of course, like the rest of us, are essentially shut-ins. They need someone to come in and care for them in their own home. So they're not going anywhere. And so we're doing all of the things that they would need help with in their home, as opposed to them having to go out and seek help elsewhere. And those homes included retirement homes. We looked after our clients in retirement homes, as well as in their own private homes. We were not allowed to go into the hospital to care for our clients there, although we would have historically gone in, but the hospitals were no longer allowing external visitors to the hospital system. And so we didn't provide care for any clients in the hospital, which I'm sure was probably to our advantage as well. Not having to go into the hospital and expose any of our caregivers as well as clients. So generally speaking, as I say, we really were only wearing masks. Of course, lots of hand washing and sanitizing, which is the nature of the industry anyway. But generally speaking, although we certainly had to stock up on PPEs, and of course, sourcing them was not easy. We really were following the clinical direction of the World Health Organization, really only wearing gloves for personal care. And so, as I say, we've been able to continue to care for our clients as a result of that throughout the process, and will continue to care for them going forward. So the one thing that I also wanted to chat about in terms of the things that we've been helping clients with is that we've been providing screening services for workplaces, call centers primarily, where there's a large number of staff coming and going 24/7 essentially. And so by providing screening services for these workplaces, it's allowed workplaces to know that their staff and visitors are coming and going in a safe manner. And so again, Sandra has the documents that we would use, the standard operating procedures, the protocols that we would follow in those workplace screening situations to allow workplaces to either continue to operate or to reopen. So hopefully that will be helpful for you if you're still yet to open up, or if you're going to be opening up more widely. Perhaps some of those screening tools will be helpful for you. And I think that's probably it. I would probably echo what Stewart said, in that it would be very important to have a good understanding of your health and safety practices, obviously a good understanding of your HR practices, because as has already been said, you know, not only do employees fear going back to work, because we've all been very diligent and doing our best for the greater good to contain the virus. But you know, their children are at home without care. The schools aren't in. They've got loved ones that are living with them who are maybe vulnerable or elderly or disabled. And so, you know, there's a lot of reticence on the employees' part to return, and that was the same with us. We've had caregivers who have not worked because they had to stay home with their kids. We've had caregivers who have not worked because they didn't want to come in contact with any COVID clients, and we've had caregivers who have left us to go and work in the provincially publicly funded healthcare system because they're paying a lot of money right now to caregivers to work in hospital and long-term care. So our business has been affected like everyone else's, but I think to Stewart's point, having an understanding of what actually is happening with the employee and how that affects their pay and whether or not they are able to continue to be paid, whether they are refusing unsafe work, etc. So I think that's it for me. Thanks, Sandra.
Thanks, Vicky. And thank you all for sharing your details. I'm going to remind everybody that if you have a question, just to type it into the chat. I do have a couple of questions that were brought forward via email before the session. So the first one is about, with the business sector slowly starting to reopen, we are looking at what we need to do to reopen our doors safely for staff. I've been working with a couple of companies to obtain quotes on how to better equip ourselves within the office with sanitation, touchless products, PPE, etc. The one thing we are struggling a little with is how to handle the kitchen area for our office. Should it be closed down? Can staff still safely use the space without contamination risk? I think, Stewart, you talked a little bit about the kitchen. Let's see, are you unmuted? Yes, you are.
Yeah.
Reiterate what you said about your kitchen area.
Well, the kitchen area was, you have the microwaves, you have your coffee machine, you have the handles, you have your taps and your fridge. So we just took half the chairs out of the place and set all the tables 6 feet apart, and they have one chair per table. And we split the lunch hours and the break times so that they were just the right amount of people wanted to use it. Plus we, encourage people to eat at their workstation or desk if they wanted to. And then after each work break, we go in and clean. We wipe down all the chairs and wipe down all the tables and wipe down all the handles on all the coffee machines, tea kettle, and microwaves. And as for what we use Lysol wipes and Lysol style disinfectant. And, staff's been very good about doing the cleaning work. So those areas are important to people. That's how they communicate. That's how they, that's the part that's the toughest thing, is the water cooler social, that's the toughest thing for staff to avoid. I don't know, so Raz and people talk about the consumer coming in, they tend to sit on the spot where they're supposed to stand, I think, my experience at the grocery store, kind of proves. But it's at the office with the familiarity of your staff and meetings. We have a rule here: if you have a meeting, it's a mask. We had to do something because we were in the conference room trying to talk to things, and we have tape on the floor where the chairs are, and half the chairs are out of the conference room. So if you're going to get close to people and talk, you wear a mask. That's all we try to enforce for PPE. But our business is different than your other business where you're with the public, or in the Pahsa's case, being a dentist is, you can't get much more intimate than that. So I don't know.
Yeah. All right, thank you. The next question was from a local hair salon in Aurora. with no reopening date yet because they're part of phase 2 and we're not quite through phase 1 yet. I've heard that some cities may be delaying by 1 to 2 weeks the reopening of businesses after the official province reopening to essentially watch and learn. Will this be the same circumstance for Aurora? I have not heard that. I don't know if anybody else has, but I don't believe that will be the case. I think we'll be following the provincial guidelines. I have the new province guidelines for personal services to reopen. They don't appear to be very strict or just recommendations. Was just wondering if Aurora will be issuing another set of guidelines for sanitation, etc., for reopening, and if so, when would we be seeing this guideline, just to be prepared? So the town does have some guidelines that they're preparing. However, they do follow the provincial guidelines. They will not be more stringent than that. And again, I think as we've been talking and why we're having these panels is to encourage people to do what they feel is right for their level of security, for their employees and for their businesses. And there is some personal choice there in terms of how you do that based on the business that you're in. And do we have any indication of phase 2 and phase 3 starting dates? No, we asked this question yesterday, and Dawn, you're on the line, but I know we said we don't have dates for those yet. It really all depends on how phase 1 rolls out and when that's completed.
Sandra,
Correct.
if I can say something, I think the guidelines we're also getting are fairly basic. Maybe in certain industries, Pahsa, you guys might have much more intricate guidelines, but I'll use our example. So the number of customers we are allowed in our store is based on our retail space, so our showroom. So it's 1 person for every 4 square meters. So that allows us to have 100 customers in our store at one time. I'm not comfortable with having that many people coming in at one time, and I don't think my customers would be happy with that. So I think, like when whoever that was that asked the question for the hairdressing, it really comes down to you do not just the bare necessity, but do anything you can that's going to be above and beyond, and that's going to reflect better on you. Because if you don't do things to a good standard, I think bad news travels faster than good news does, and it'll be a reflection on your business.
Absolutely, and that's a good point, Russ. Thank you. Does anybody have any other questions or comments that they'd like to share or experiences that they'd like to share? I can unmute everyone if there is anyone who would like to speak. Stewart?
Yeah, a quick question for Vicky. You have this program for companies to test their employees coming in. Do you use it on your own employees? Like, is it something that you need to administer to your own staff?
So we use a app-based software system that all of our caregivers access all of our client data on their phones, and it's right there on the app every morning. They have to do their screener by 9 a.m. And of course that screener pops up on my dashboard, and of course I review all of them, and they have to say no to everything, and if they've said yes to everything or yes to even one thing, then they need to let me know, and they take the day off and possibly 14 days off depending on the situation. But yes, we do it every day with our caregivers as well.
For our staff too, I'm going to jump in there for a second. We do have to do the same screening and temperatures twice a day, 1 in the morning and 1 in the afternoon, to make sure there's no symptoms or anything. It is.
Yeah, I think the long-term care homes and even retirement homes are now doing twice daily temperature checks on all of their residents as well, because what they found was that even if you felt well in the morning, you might not feel well still even as early as the afternoon or after lunch, and so it can come on that quickly. So I think twice daily is a wise approach when you're coming close to people.
Yep.
Thank you. There's another question. For those that are open, if an employee is sick and needs to self-isolate, who pays for them to be at home? Has anybody had that situation?
Well, in our case, sorry, Raz, in our case, our caregivers are not paid if they're at home sick.
Are they contract workers with you, or are they?
No, there are employees, but it's just the nature of the industry. They don't get sick time.
Okay, thank you. Raz?
Yeah, in my case, they're paid hourly, so they would not get paid, and we are looking, besides waiting response from if they're getting tested, until they get tested, they would be on quarantine from the store. So.
Stewart?
The CURB program was pretty responsive to the employees that were not working, for whatever reason. So I may want to try that right away, just get them to, because when Doug Ford came out and said, okay, shut down for 2 weeks, we shut down for 2 weeks, everybody went on layoff. I wasn't involved with a return date of 14 days from then, just to be kind of helped out in the situation. And they got turned on to the CURB program rather, instead of staying in the unemployment insurance program. So if your people are off, there used to be short-term disability or short-term sick leave in EI, which I think has been flipped over pretty fast to CURB, so they can jump onto that rather quick. If they're off for 14 days, that is significant. Even a week is significant. So we made a deal back then with our employees. We paid, if they were on CURB, we paid up to 75% of their wage, which helped to build, I don't know, some goodwill, I think might be the best term. And that's not always possible, I understand that, but take advantage of the government programs, and they're very flexible and they're very quick and the employees can do it online. And we help them do it online in the office to set them up in the system before they went on that short-term layoff.
Mm-hmm. And there is some criteria that you have to meet, but you're right, Stewart. I think it's 2 weeks out of a month. If you're not working, then you're allowed to go on CERB. So there is that help there for employees.
And I think they also do have the up to $1,000 a month limit, even in income as well, $250 a week. So I don't think they have to definitely be on EI. My understanding is, or laid off, right, to qualify.
That's also correct. Yeah. Yeah. Are there any other questions or anything that anyone would like to share? I hope everybody found this useful. We do have a recording that we'll be sharing with the community. So if you're on this call and you see the recording, if you could actually share it with your community so that more businesses see it, that would be wonderful. In terms of the chamber, we do have a COVID-19 page that has a lot of resources there. We have PPE suppliers listed for both Aurora, York Region, and Ontario. So our preference is always to keep everything local if we can, support our local businesses, and that would be our first point. But then we also have York Region and Ontario. So I put our website and the COVID-19 page. Our contact information is all in the chat if you want to copy and paste that for yourselves. But we encourage you to reach out to the chamber if there's anything that we can help you with. We're always here to support business, and hopefully if you have any ideas of other ways that we can support you, please feel free to reach out to me personally. I'd be happy to do that. Dawn, did you have some last words you wanted to say?
Oh, I just wanted to make a comment, because this is something I have not thought of in opening up the constituency office again, and this came up in a meeting I had yesterday, that offices where we have a business coming in to clean our office, that we should be engaging in a conversation with those businesses, that if their employee who's coming into our office to clean, if they've been diagnosed with COVID-19, because we do not want people sick or who's been diagnosed with COVID-19 coming into the office. So I throw that out because I hadn't even thought of that. And this came up on a call that I was on yesterday. So I throw that out there to everybody.
Thank you. Good point. Anyone else would like to say any closing remarks? Well, there is one more question that someone's just posted. What has been anyone's experience with landlords, especially in cases where there is common office area, i.e. what additional measures are being expected on being or being made by the landlord? Has anybody had that circumstance?
We don't have office space, but we, in our retail, so we have 2 stores, one in Aurora and one in Newmarket. And I can't tell you which landlord, might not be right, but one landlord has finally agreed to apply for the rent relief, which is a big relief for us. And the other landlord has graciously declined. So I think best I would say is just keep reminding your landlord, is there anything you can do? I really need your help. You know, yes, they have expenses too, but if they, you know, it's a huge cost for all of us. Rent and employees are the 2 biggest costs that we all have. So just keep reminding your landlord, keep in communication with them and tell them, you know, just keep asking them to apply. So.
Yeah, our landlord has been fantastic since day one when we spoke with them. They got on board right away and they've helped us out. So it's been very good.
Great.
I think this question was specifically around modifications that we needed to do for open areas. Stewart, you have an open area? Have you had, I guess your employees are not fully back yet, but have you started to think about what that would look like when they come back?
Yes, we've been looking at office furniture. Funny enough, I belong to a business group and the person makes those barriers. But for the most part, we just kind of spread out around it's more in the hallways and the aisleways and the washrooms are the things that are the biggest. People self-protect when they think about it. It's when they just fall back to their nature that is tough to monitor.
Yeah, I can tell you, I mean, I know of a couple of larger companies and what they seem to be doing for the future is not having everybody come back to work full time. So what they'll do is they'll have people working 1 or 2 days a week and they'll rotate them through. So if they have space for, I don't know, 250 people on a floor, they may only be bringing back 50 to 100 to be able to space them properly, especially for those businesses that have wide open areas. So space is going to be an issue. A few years ago, maybe 10 years ago, everybody was moving towards open space, no offices, open desks for collaboration. And now we're seeing that we're going to have to pull back on that a little bit and have more space or dividers or cubicles or something that's going to be more protective for people as they're in their office spaces. So I think we'll just hear more about that as the bigger businesses and offices start to reopen, I think. All right, any other questions? Well, thank you, everybody. I think this was great. A lot of really good information shared today. So thank you very much to our panelists. And as I've said, our contact information is there. If there's anything else you'd like to see or anything you need, just reach out to us. We're always here. All right. Have a great.
Thanks for having us on.
Thank you.
Thank you
Thanks
very
for
much.
having me.
Yes.
Bye-bye.
Thank you.
Bye.
Safe, everyone.
Bye-bye.
Bye. Stay safe.
Bye-bye.